So I think for most of the people that would be tuning into this are in healthcare, like I had said in the introduction. And so the first question that I have for you is, does this apply for healthcare?
Well, the easy and short answer is, of course. The longer answer is how. And, that really is looking at, some of the principles. And I'm going to pick out just a couple of them. I'll ask you to pick out what you think might resonate. But I'm going to start with principle number 1 in the test cycle, which is encourage successful failure. Now, I'm sure some people just kind of went, what? Right?
We can't do that.
We can't do that. Patients. Right. We could kill somebody. My son-in-law is a medical physicist. So, again, I remember him early on when they were dating, saying something like, I need to kind of make sure the radiation is right, because if it's not, we could kill somebody.
Right.
So I do get that you need to be careful. And if you're not experimenting with something new, and I think about all the medical advances, right? They started out as, I wonder if, or let's try this experiment.
Yep.
And from Bezos' perspective, that's actually the core at Amazon is invention. And he said that, you may have read that he announced he's stepping aside as CEO and moving into an executive chairman position. But in his email to employees announcing that transition, he said, Amazon has been successful. What's the key to our success? Well, he says it's invention, which I think is very interesting, right? Because we talk about innovation and we talk about all these things, but what he goes on to say is that, we have invented new things that have become normal.
Yep.
Right? A Kindle e-reader was a new way to consume a book, but is now normal. A review of a product or book on the Amazon website was new, but now I'd say nobody, but most people will look at reviews before they decide on what product they want to buy. So I think, yes, absolutely, you have to be careful and you have to experiment. And if you're experimenting, you're going to fail. Because if you know you're not going to fail, it's not an experiment. And how you learn from that failure, and that's the phrasing, successful failure.
Yep.
A failure is a failure. Yes, you want to avoid it. And even Bezos says later on that, there's a bad kind of failure. And the example he gives is fulfillment centers. He says, we've built a lot of them. We know how to build fulfillment centers. So if we build one and it's a failure, it doesn't work, that's an operational failure that's unacceptable.
Right.
And the way I phrase it is that Amazon has an intolerance for incompetence. So that's not what we're talking about. But we are talking about, I wonder if this will work.
Yeah.
And that kind of idea of then taking those experiments, learning from them to create something new, I think is a core concept that I think does apply in the insurance area, and especially with the work that you've done, with innovation within that sector of the economy.
I think it's so true. And I hope everyone that's going to listen to this really takes that to heart, because it really determines like how you filter successful failure, right? How you interpret that. We're not talking about half-baked ideas. We're not talking about, even the word MVP, minimal viable product, people are like, well, we can't do that in healthcare. Well, we're not talking about like a car with 3 wheels. Right. It still needs 4 wheels. And so, as long as you are, practicing like the stuff that we know to be true, like around IRB, when we're conducting research and testing things, there's going to be some different guardrails and some different concessions or considerations that we need to make. But don't get so afraid of it that we lose out on being able to make sure that we're building businesses that are sustainable in the long term, because we weren't continuing to invent or innovate because we thought, well, we can't do that because that's dangerous in healthcare.
Yeah, one of the phrases I use a lot is that the biggest risk a successful business takes is their success, meaning they're successful. What got them there, they start protecting, not looking at what's next. What else can we do? And one of the favorite phrases Bezos uses is, what else can we invent on behalf of the customer? Mm-hmm. And I think keeping that in customer, be it the patient, be it the doctor, be it staff, within the organization, what's their friction point? What can we do to help improve what they do and how they do it and the experience that they have?